Selinexor is a molecule that has been approved for several indications, including multiple myeloma and diffuse large B-cell lymphoma. It is an inhibitor of exportin 1, which is a molecule that mediates the transport of proteins from the nucleus into the cytoplasm. So in myelofibrosis, which is a hematopoietic neoplasm, typically relatively complex, mostly associated with mutations in JAK2 or other JAK kinase pathway activating mutations or genes, is not curable with current drug therapies. In fact, patients respond to JAK2 inhibitors, but after a while, in many cases, they will develop resistance and will lose their responses. So what we found several years ago, studying cell lines with JAK2 mutations, is that these cell lines are exquisitely sensitive to disruption of nuclear-cytoplasmic export. So it was based on that data, it was logical to see whether one could perhaps restore responses or actually induce responses in patients inhibiting nuclear-cytoplasmic export. And so this study is actually looking at that, and it seems that this, as far as we can tell, based on a relatively limited data set, does have clinical efficacy. So it is effective in patients who became resistant to JAK2 inhibitors, and we'll see how that continues.